So let's talk about different ways to treat eczema. I'm Dr. Rose. I'm a board-certified dermatologist practicing in New York City, and I've had this conversation quite a few times with my patients over the past few days, and a lot of them were surprised at the treatment options and why we choose certain things, so I thought I would make a video about it. I just had some extra time because I'm just sitting in my car waiting for alternate side to start, hoping I don't get a ticket, and this is something that, we New Yorkers with cars tend to do. Okay, so maybe you're here because you've just been diagnosed with eczema, you're a little bit confused about it, it keeps coming, keeps going, you go to the dermatologist, you get a steroid cream, you're a little bit concerned about putting this cream on your skin, it usually works, but then the eczema comes back. So this is, in fact, a feature of eczema. It tends to come and go. It waxes and wanes depending on what you're doing with your skin. Like, if you're doing a lot of wet work, if you are swimming a lot, just anything that strains your skin. It also depends on the weather around you. Sometimes in colder months, with the humidity down, your eczema will return, or sometimes in warmer months with sweating and irritation, your eczema will return. But this is in fact a feature of eczema. It comes and goes and is to be expected. So with eczema, there are genetic as well as environmental factors at play. When you actually look at biopsies of the skin with eczema, there are some changes that are apparent, and these are common in all different forms of eczema. You see an immunological compromise of the skin. There's certain immune factors that are present in skin that are depleted in eczematous skin. So your skin is more open to infection. Another thing you see is that eczematous skin has structural deficiencies. There are certain components, ceramides, filaggrin, that are missing from eczematous skin. So eczema, in its true sense, is a compromised barrier, and it's an inflammatory reaction. Your skin is swollen and compromised. And this results in having itchy skin, patches of skin. Usually it's flaky, red, or in some cases it's hyperpigmented, depending on the skin type. Now, we know, we have decades of experience with topical steroids. You slap on a topical steroids and all of those abnormalities that I told you about, the immunological as well as structural abnormalities, reverse. So you go from a compromised barrier to a restored barrier. While I know a lot of patients are a little wary of putting topical steroids on their skin, the risk-benefit ratio is actually really, really favorable, and this is why we use topical steroids a lot in dermatology. There have been studies looking at the risks of topical steroids and what do they do to your system. Very little is systemically absorbed, so you don't have to really worry much about that. Risks usually include topical side effects like skin atrophy, striae, steroid acne, which can be difficult to treat. It's very rare and a very low risk of it actually doing something, internal, unless it's wildly inappropriately used, like put all over the body under occlusion. So you'd have to be unsupervised for a long time with a very strong steroid in order to do real harm to yourself and to your well-being. So it's for this reason why dermatologists prescribe topical steroids, and they also choose the appropriate one for the skin that they're treating. There's a different steroid for the face, a different steroid for the palms and soles, a different steroid for the body. So that's oftentimes why you will exit your dermatologist's office with a few different prescriptions. And they will also tell you it's not for long-term use. So we know that topical steroids reliably treat eczema, and this is why we often reach for them. We also have some non-steroidal topical medications that we can use, but they tend to not be as effective as the topical steroids. So oftentimes you'll have a mix of that in your regimen. Now, if you have really, really bad eczema, other options, a few patients have asked me about UV therapy. This is basically where we therapeutically use UV rays to treat skin conditions. Now, obviously, UV light or ultraviolet light is carcinogenic, so we'd have to weigh the risks and benefits depending on the patient, and we would see if this is an appropriate option. UV is used therapeutically to treat cutaneous lymphomas, recalcitrant itch, and very bad psoriasis and very bad atopic dermatitis or eczema. So you'd have to weigh the risk-benefit ratio. Is it worth the risk of skin cancer and photoaging? And this is something that I probably wouldn't use in a very young person, but in an older person who, they don't have to really worry about the malignancy risk that it's going to cause in 30, 40 years, I might use it if they have very bad eczema. But it's not really my first line treatment. Back in the old days, for really bad eczema, we also would use very low dose, basically chemotherapy, in order to keep it in check. This would require lab tests, this would require checking on the patients, and obviously this is a higher risk treatment. But for some people with really bad eczema and really bad atopic dermatitis, this was a good option, and it increased their quality of life. Now, what's revolutionized our treatment of eczema and atopic dermatitis is Dupixent, which is an immunologic treatment. It's an injectable medication, which is very specific for the inflammation that's in eczema. It's not that immunosuppressive, which is really incredible, and it has really changed the way we treat it. It has been a really great therapeutic option, and this is something that I discuss with people who have really recalcitrant eczema, and no matter what we do, it keeps on coming back. But again, it's a systemic medication, and even though it's not as immunosuppressive as the oral low-dose chemotherapy that I mentioned, it still is not without risk. So it's something that needs to be discussed with your doctor if the risk is worth the benefit. So this covers most of the therapeutic options that are at our disposal with eczema. If you have any questions, leave them in the comments. And if you do have really bad recalcitrant eczema, you definitely need to be in the care of a good dermatologist. This is really, really important. Long-standing eczema can transform into other things. The most worrisome is a cutaneous malignancy, which is like a cancer. So it does need occasional biopsies to prove the diagnosis, and sometimes it's not that straightforward. So please be good to your skin, and I hope this helps some people out with their eczema treatment.